So one of the things that I wanted to prove to you today is I want to prove to you that we are invisible. Do you believe that? Mostly invisible anyways. How many people believe that we're mostly invisible? You do? Yeah. Nobody else does, so I'm going to prove it to you. So physics trumps over chemistry. Chemistry is anything that's physical, right? You can touch it, you can feel it. So step on this hard floor right now. Go do like that, step on it. 99% of that floor is space, electronic space, and you prove that through physics, through the atom. The atom is 1% neutron and proton, and the rest of it is electrons or space. So you're invisible mainly. And that invisible electronic space is what directs the activity and health of everything in the body. You can prove, actually they've proven the existence of electronic fields on the body. They're invisible, called meridians. And that's what I treat. And so when I do muscle testing, it's a weird thing to many people because they don't understand it. I can actually find out if they're vitamin D deficient. Okay? So who would like to be a guinea pig? So muscle testing is a very scientific way of determining without injections or without needles. You don't want me to inject you today, do you? I didn't think so. So it's a very powerful way to determine what's going on with the body through those electrical fields. There's a reflex right here over the liver. That's the vitamin D reflex. So I'm going to have you put your hand there when I tell you. Okay, but first I'm going to make sure she's testable. So the way I make sure she's testable is I actually put this arm over here, and you're just going to relax. Tell me your name again. So Crystal, I'm going to use her arm to determine if she's testable. So I'm going to put my finger right over your nose. Can you take your glasses for a second? So what happens to the thumb is it changes after I put my hand right over the nose. So you feel it yourself just by feeling your arm, okay? Let's see if you're testable. Yeah, see that? Do you see the change? The camera sees the change, but the arm moves more when I test right over the head, and that's actually good. So here's before. I'm pushing pretty hard. I can't get it past that point, and if I go like this, it just changes more. Okay.
That's weird.
Weird. That means that you're very electronic. That's good. So now I'm going to take your hand, put it right here, and put it right over your vitamin D point. Now right over your liver. Okay. Slightly. So it's slightly weakening, and it shouldn't now. It should not weaken when I get over the vitamin D point. Yeah, and it does slightly weaken. Yeah, it does slightly weaken. So what that means is she's probably deficient in vitamin D. I've done over 100 lab tests to prove this, that I'm pretty much close to 100% correct when I find that reflex. People are epidemically low on vitamin D, and that causes a myriad of other symptoms. So you just can't do a cheap vitamin D. Don't go to Walmart and get a cheap vitamin D because it doesn't work. You have to get something that's a professional grade supplement that will do the job. And so I can do that with all the reflexes of the body and find out, okay, did this person have an infection? Even though we don't treat infections, right, Dr. Cowell? They may have an autoimmune condition, even though we don't treat an autoimmune condition, and find out if they're allergic to wheat or to gluten. Is anybody gluten free here? Anybody gluten free? So it's just a few people, mostly gluten free. So you know that at least probably 30 or 40% of you are probably gluten sensitive, at least. Okay. So I can do that with muscle testing and figure out what's going on with the body. So it's a very valuable tool that I don't have to inject them with, and I don't have to do a bunch of lab tests. But in her situation, I would go ahead and get the blood test anyways, because I want to know if the vitamin D is working for her and it's increasing the numbers. So thank you very much. I appreciate that. Who wants to be tested for sugar?
Me.
Okay. So there's another way to test here. Let's see. Hold your arm out like this. Hold. Don't let me push down. Don't let me push down. Okay, so he weakens. And if it weakens, just let it go.
Oh,
hold.
Okay.
Hold. Hold. Uncross your legs. Hold. Hold. He's pretty strong, but hold. See, he weakens. Okay, that's another way to test. It's not as accurate. Hold. 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 Sugar. Boom. You can't hold his arm up.
I didn't have breakfast.
Oh, you didn't have breakfast?
I had a couple.
It would actually, well, that sugar, if you didn't have breakfast, that would have maybe stayed strong because he needed the sugar. So here's chlorine. Hold, don't let me twist down. hold, and boom, it just weakens. So you can test things like that because you can just put this right over a light circuit and the frequency of that item goes right through. It's light energy, right? It's a frequency. So if you put another frequency and it weakens this, his brain knows, and it's very smart, body intelligence center, it's very smart, and it will weaken when you put it right next to his frequency. So that's the tool. It's really powerful, and you can get tested for a bunch of things very accurately, more than even doing lab tests. I tested myself for stool, not here at breakfast, but anyway, for parasites, and it was positive, but it still didn't reveal everything. So the rest of it was taken away with muscle testing, and I found out I had some parasites, and it took away my cat allergies. I was shocked because I had that for over 50 years. Okay, so thank you very much.
Thank you so much, Dr. Ball.
Of the amazing creation that God has given you guys, in you. I found this picture about 2 or 3 years ago when I went on a homeschooling trip, and it was from NASA. They took a picture of the energy fields of the Earth. Oh, so there's energy fields around the Earth that I never knew about. That and the thing that's so cool, can you see that?
Right in the middle of that round thing?
That's Earth, right there. Yeah. And because of this, meteors don't hit us. Well, I mean, we'd be dead, right? Because meteors are showering all around us all the time. But they only, I don't know what causes certain meteors to enter the atmosphere or not. But most of them don't. I guess that's the point. And that's why we live. So this is so cool because the energy fields around the Earth is what is around us. So that's an energy field around the mushroom. That's a very vital mushroom. That's a very sick mushroom. It's loaded with pesticides, inorganic. Okay. So what you are what you eat, right? So if you eat stuff that's like not vital like this, it's full of pesticides, you're gonna not be vital or not healing. So this is the energy field around the body. You can actually measure this with Kirlian photography. It's a way to measure the electrical fields around the body. Now people think aura, then they go, ooh. There actually is an aura around our body. It's just all it is an electrical field. You can actually measure it. So this is the median, or called the meridians, on the skin surface of the body. So each color represents a certain meridian. These central ones, the red one here, are major meridians. They control other functions of the body. And there's one in the front and one in the back. That's why chiropractors, they deal with a lot of different conditions because the spine controls so many other things. And that's where the back one is. The front one is just as important. So surgeries, I find quite a bit that shut down the body. And what I mean by shut down the body is these are all electrical fields that control functions. So if this central one is going right through your thyroid and it's cutting with a scar from a thyroid surgery, guess what? You've cut that field right there, that electrical field. Now you're not getting any communication to other parts of your body, including your thyroid. So I've seen people with thyroid conditions. I gave them a mud pack to clear that scar, and it clears it for about a year. Wow. And she had all these weird symptoms. She came to me for symptoms here, but I said, you know what, you need to clear this scar. So she put the mud pack on there, and she had all her symptoms, like she had allergic reactions, I think, cleared up just because she cleared this. And so it depends. So that's the importance of dealing with the electrical fields of the body. And so the thing that's really cool is that you can actually find through muscle testing different parts of the body that are out of balance. I had a lady that came in that I demoed. In fact, Pearl mentioned this to her son. She publicly mentioned this, so it's okay to share this. I mean, I was just giving a demo to Pearl, and I found that she had mold in the bone marrow. Okay, and I didn't know anything about her history. And I go, do you have mold? She goes, well, yeah, it's kind of in my house. And it's in I think it's in one of the closets. So I actually gave her a petri dish to take home, and she put it in there, and she did the thing with the petri dish, and it came back, oh yeah, there's mold. So she may need, unfortunately, in order to resolve, things, and unfortunately her roommate is sick all the time. You know, I mean, she's exposed to mold all the time. And so I didn't know anything about that, so that really convinced her that, you know, muscle testing was accurate. Does anybody want to do a demo? Okay, Lisa, come on.
Test me.
So I want you to turn around and close this. Turn around and stand right here.
Okay.
So put both hands right up here. And so I can actually check Lisa's vitamin D reflex. Okay, it's at an epidemic proportions vitamin D, lack of vitamin D, right? Do you guys know that? They say 40-50% more. That's why medical doctors are actually doing vitamin D tests. So when I find that reflex blowing, what I mean by blowing is this. So scoot forward just a little bit. We'll step on the wires.
Okay.
There you go. So now I'm going to use her muscle to test, to make sure she's testable first. So look straight ahead. Okay, so and you can feel this in your head, just how much your arm is moving and how easy it is to move. When I put my fingers on her forehead, the reflex will blow. It's like an autonomic nervous system reaction. So watch my thumb. I'm going to put my hand right here on her forehead. Watch my thumb. Okay, see, here's before. It doesn't go past that, right? It's stuck right there. No matter how hard I push, but if I go like this, see the thumb change?
Isn't that weird?
So that's a positive test that she is testable. Now I can go over those meridians that go down her body and check different reflexes, and she can actually gauge how off she is. Because her body, do you think it's smart? Say yes.
Yes.
Okay. It's very, very smart. God created it very smart. You're doing a million reactions right now automatically, and that's what I'm assessing, is the autonomic system of the body, the nervous system of the body. So I can check adrenal, kidney, adrenal. I'm just checking different organs right in the location of the organ itself. I can check the vitamin D reflex from this other side, because you're going to touch yourself doing this. So you're going to put your hand underneath your right breast, right over your ribs. No, the other way.
Oh.
This is going to relax. Okay, let's see. Now relax your arm. That's it. Good. Take your hand away. Take this hand away.
Take this hand away and take it where?
Yeah, put it right there. Now put it right there over your ribs again. So I'm not picking up a vitamin D reflex on her. Are you taking vitamin D?
No.
Are you getting it from you're probably getting it from your foods then. Okay, so
I
anyways.
take spinach.
Okay.
And,
do you take vitamins?
No.
You don't take vitamins?
No.
Okay.
Almost daily is the spinach and then the spinach smoothie.
Okay. Okay, put your hand down. So now I'm going to check a couple reflexes. Physical, brain, and chemical. So that blow. And that 95 to 100% of my patients, that will blow first. A chemical imbalance in the body. And so there's something chemically imbalanced in her body. And so I can figure it now. I will go through a series of sub-reflexes. Now, I don't want, it's going to be too much to train people like you guys every reflex, unless you really are working in this area. But there's some basic ones. Vitamin D, there's some infection reflexes. I mean, you can really tell a lot. I found parasite reflexes on me that got rid of my cat allergies. And so there's so many things that you can do for health that will help with just, if you're sensitive to food, you can put that food right next to her and her muscle will blow. So do you have any sugar?
When you mean blow, what do you
will
mean
weaken.
by that?
It will weaken.
And so was that I am vitamin D deficient?
So I didn't find that on you.
Okay, so what would it look like if I was? What do you mean?
It would do that thing that did over there when I touched this.
Oh, it would have twisted.
It would twist it more.
It would twist it.
It's normal when I touch here to do that.
Okay.
It's not normal any other time.
Can you test vitamin B?
No. Well, no, that's one, there's no reflex with it, but I can do a general thing too.
Okay.
So she's going to give me,
See, everything's in glass jars. So
that's perfect, just leave it out.
Okay.
You leave it, this is sugar?
Yeah.
When did you eat last?
Oh, just before I came.
That's perfect. So she shouldn't be hypoglycemic, right? She had some food. Now let's see what happens. Here's before, and here's after. See that line change? So she's reacting to sugar, which everyone will, unless they don't have any sugar in their body. Because this has a frequency to it.
Isn't that funny? That is just the coolest thing. You could hold it.
Yeah.
Yeah.
It'll cause the muscle to blow or
it's
short
just the
circuit.
coolest thing.
It's kind of weird, huh? It's strange. It's strange. You can just put something on top of the body and it'll react.
No, it's
You can feel it. Here, who wants to get
It's
some
really,
check
really
next?
cool. I've gone to a doctor where he told me to hold these pills.
I've had this done before.
Okay.
And it's
Do you
just like,
want
Thank
me
you.
to
Lisa.
try it?
Yeah. Whoever wants to try it, I'll put
Yeah,
it to
it's
them. Unless you need to
So
eat.
let's do wheat. I already.
Okay.
So what does that mean? So what should I like?
Right now, all we know is that I checked your vitamin D. I may need to check it in a different way, but you just react to sugar, which everyone's going to react.
Oh, okay.
So now let me make sure you're testable first. Let's see. Okay, so she's reacting. That's good. So now, did you feel that?
Yeah.
Okay, good. Now relax your hand here. Just relax. See, it blows. And it should. Now, if I put a phone, that can blow actually too. Sometimes it has to be on because of the cell energy. Because this is toxic. You know what I mean? That cell energy is microwave energy. You know, they've seen some things cause cancer, but sometimes I have to actually have it be calling someone to get a reaction. But I can do anything. I can test anything. So you guys can do that at home. Do you have any wheat?
I have gluten intolerance.
Let me check something else. No, just stay right there. So kidney, renals, physical, neurology, chemistry. So that everybody almost blows on chemistry part. So there's something chemically imbalanced in her.
So you can tell
Can you
if
find
there's
any
something like with your brain?
Oh, wheat? Yeah, I'll get it.
Get some bread.
You can tell a lot. This is the beauty of preventative medicine.
Right.
Yeah.
Because you'll know if someone, I mean, I had a lady that came and she kind of knew what I did, but she came to do a presentation. I go, well, let me just check you. So I just did a really brief check and I found she had an infection and a hormone imbalance in your uterus.
Wow.
And she goes, you know what, they want to do a hysterectomy on me. And so I just gave her some supplements and it resulted. It may work through the plastic, sometimes it doesn't. Let's see. So she's blowing a little bit. See, it's not as, if I take it out, I may get a bigger reaction.
You want to keep it now?
It's my husband's.
Otherwise, I would.
She does blow out to it a little bit. If I took it out and she ate it, it'd probably really blow, meaning that her arm will just really react. Is there anything else you want me to say? Okay, now put your hand right underneath your ribs, right there. Let's check vitamin D. See, now she's blowing. See? You're lacking vitamin D.
Should I stop eating ice cream?
You know what? Milk is not going to give you enough vitamin D. I'm going to tell you right
Now
now.
that's enough to get a reaction.
Yeah, I mean there. See, a big reaction. So something. Yeah, sure, you're probably sensitive to wheat.
Yeah.
But you probably need you could need a lot of vitamin D. What I would recommend someone in that kind of situation is going get lab work to see what your vitamin D level is. People that I found this reflex on, you can actually. This is going to sound weird, but you can actually dose them, okay, on how much vitamin D they need. And if I dose them, and they need like 10,000 IUs, that's a lot. I say go get a blood test because I want to know for sure. And I've been close to 100% correct if the blood work being really low when I find that reflex. So it's very accurate.
I can testify the vitamin D. My doctor tested me. I don't know why she tested me for vitamin D, but I get my lab results on the computer. And so the vitamin D was like off the chart low.
Wow.
Off the chart low. And I didn't tell him, but he tested me and he goes, you're really low on vitamin D.
Wow.
Yeah.
Hi, welcome to my clinic. My name is Dr. Paul, and I want to answer some of the common questions that my patients have when they first come in. One of the questions is, can I help? And the answer to that question is, yes, I would love to help you. Over the last 20 years, I have developed my own technique that may include comforting laser, cost-effective homeopathic treatments, soothing cranial work, deep muscle active release, no popping chiropractic, acupressure massage, nutritional guidance, and avoiding toxic exposure so that your condition doesn't relapse. You may not need all of these treatments. In fact, less is more. Now comes the fun. I'm one of a few docs in the US that can zone in on the causes of your symptoms, looking at the whole body, using a unique muscle response system that can locate the stressed organs and the toxins that are compromising it. Once we determine the root causes of your symptoms, we'll tailor-make a set of homeopathic remedies and possibly do some other therapies to begin your healing process.